You know, of all the skin or facial problems, one of the most difficult to treat has always been melasma. Melasma is a tan or dark facial skin discoloration that mostly affects adult women. It's often called the pregnancy mask because it can develop during pregnancy. Very difficult to treat, as I mentioned, but a new laser procedure is working magic. Dr. Steve Jepson is here to tell us more about it. First, tell us, what is melasma exactly?
Well, I think you described it really well. It's just kind of brown patches that develop on the skin, often come on in early female adulthood, usually with birth control pills or pregnancy, and it really can be kind of difficult to cover with makeup, and I think a lot of women really suffer from this.
So it's hard to hide.
It's really difficult to hide.
What are some ways you treat it? You say the first, avoid sun exposure?
You know, an ounce of prevention is worth a pound of cure, and so if we can have our kids covered with sunblock and keep our teenagers from the tanning beds, it goes a long ways towards preventing them from developing the melasma later in life. And if a woman has melasma, by keeping it covered with sunblock, it makes a big difference in terms of keeping it from getting worse.
And we're going to get to this procedure in just 1 second, but first, another thing you say is the lightening cream.
There's a lightening cream called hydroquinone that you can get over the counter, or a doctor can prescribe it at a much higher dose, and it can be effective at fading it somewhat, though it seldom gets rid of it, and for some people it doesn't work at all. But it's a reasonable alternative for some women.
And here we're seeing this laser procedure, which we're tying into the word magic because it really is working miracles in these face discolorations. Tell us about this.
Well, you know, I've been doing laser therapy for a number of years now. We've always tried to treat melasma. There's a great before and after picture of a girl that we treated at our office and another lady. In terms of, you can see that the before and after, the pigment's there, and then it's gone magically after one single treatment. Every one of these women, these 2 women that we've shown today, they've had only 1 treatment with this new laser. I introduced it on the show back in October. It's called our ActiveFx laser. On that segment, I talked about more what it does in terms of wrinkle reduction and on skin tightening. It's done great for that, but I've been pleasantly surprised at how well it's worked for melasma, and I wanted to come and tell the viewers about it because I've had these women for years that have tried and struggled to get rid of this deep pregnancy mask, and nothing's really worked for them, including many of the past laser therapies that just don't go deep enough to get this deep pigment. But this ActiveFx laser goes down deep into the skin, down in the deep layers where the pigment lies, and as you saw from those 2 before and after pictures and the other many women that we've treated with this condition, 1 treatment has been able to go down deep enough and remove that pigment and just get them to where their face is beautiful again.
It really is amazing when you consider that 1 treatment, like you pointed out, can change the color of the skin, and those before and after examples were amazing.
And just restore your normal color. Get rid of abnormal pigment and restore normal color in 1 treatment.
And is the 1 treatment, is that common? Does it take more for some depending on how deep the color is?
You know what? Honestly, everybody that we've treated so far in the last 5 months, 1 treatment, their melasma's gone.
It's really a great option.